through different things. And again, the topic is trauma and attachment in adopted children. We will have a short video at the end, and then we will open it up to questions, and any questions are very much welcome. So what is trauma? So we looked it up, and trauma can be defined as a psychological, emotional response to an event or an experience that is deeply distressing and disturbing. So that's just general description of trauma. And Mary Carole, I really like that what you found by Russell Barkley. Are we on the other slide? That the kids who need the most love will ask for it in most unloving of ways. And we certainly do know that. So next, what are we going to talk about today? What happens with trauma, and at what point in life does trauma occur? I mean, it starts from prenatal care and how the mother feels and what life she leads. Oh, I hear a lot of, I don't know, Mary Carole, what you can do. Can you guys hear in the background a lot of kind of repeat words or not?
I think it's okay now.
Okay. So, and what happens in mother's life during this initial, during her pregnancy? How does she feel? Does she feel stressed? Is she a victim of domestic violence? How is she eating? How is she sleeping? Does she use any substances? All of that starts influencing the child and creating potential trauma down the line. Care at home. What's happening? I mean, does the child get proper nutrition? Is the child cared appropriately by the caregiver? And we will use the word caregiver again and again, because in some situations, it might be not a mother, it could be a grandmother or another family member. So caregiver would be our definition. You know, what happens with this child during initial first years of this child's life? And what about stressful environment? And what stresses out the child? So we will talk about it in our further conversation, but each part of child's life is very important. And even children are young and often not able to understand certain things. They internalize, and they're constantly watching us adults. So everything we do does matter. So let's start our conversation with what is parenting, and how do we measure what is enough and what is not enough? You know, is it enough to provide plenty of, you know, of good food? And does type of food matter? Is it enough to have warm shelter? Is it enough to have consistent caregiver, whether it is a mother or father or grandmother? What about structure and routine? What is appropriate structure and routine? Because we all have different opinions on that. We all grew up in different environment, in different families, and that forms our perception of what is sufficient and what is not sufficient. What about emotions of the caregiver? I mean, how does our mother or father or whoever is caring for us, how do they feel? How do they express themselves? What is their tone of voice? What is the expression on their face looking like? And how much interaction does each child have? So yeah, that's okay. What do we remember from our childhood? You know, we could remember climbing up in parents' bed on the weekend and giving hugs and kisses. We remember maybe our favorite soup or noodle dish, or our favorite cookies our mother or father or whoever is our caregiver we're providing to us. Maybe we remember how our mom or dad worried about us when we fell off the swing, or we had a high fever, or we smashed our knee running. Children remember that because that care and that is nurture. Another things we might remember is stress at home. Mom and dad were yelling at each other. I was hungry and I wasn't able to find food. People were spanking me because I spilled a cup of milk. Being afraid of the family member, or maybe being worried about being dropped off at Uncle Bill's house because Uncle Bill keeps talking in the background how he can't wait when my mom will pick me up. And I'm just sitting at the table and staring in the corner and feeling that I'm so unwanted. And I remember it when I become an adult, right? Moving from one, moving from one place to another and having that worry in your heart. All of us, when we become an adult, we remember, right? Did our parents have an argument? How did we feel when we were a child? So all that creates memories. So it could be something very positive, maybe with occasional stressful things, or it could be something so stressful and so repeatedly, making me feel I am not important. I am nothing. Nobody cares how I feel. People say, you better know your place and you better go and do your thing and we don't want to hear about you. So developmental delays occur as a result of this, interruptions in child's life, in child's security, and in child's development. We could go to the next slide. And guys, if I mispronounce something, I'm originally from Ukraine. So sometimes I mispronounce things, but hopefully, if you do have questions, you will be able to ask. So how do all these different circumstances influence and lead to potentially ending up in foster care and ending up in adoption? And Mary Carole, I will let you maybe cover a little bit about the foster care part.
Sure, yeah. So as many of you might be familiar, foster care typically comes when someone is alerted that they're concerned about the safety of the child. So, that could be a teacher noticing that the child is coming, with the same clothes 3 days in a row, and they make a phone call to the hotline. It could be abuse that's been witnessed. It could be, lack of nutrition. It could be struggling with substances and substance abuse. So there's a lot of reasons that children may end up in foster care, but the main difference would be that the state is getting involved and the state is concerned about the, safety of the child. And as we'll talk about, the foster care goal is always reunification. So the goal is always to get mom or dad or relative back on their feet to be able to, hopefully reunite with the child if they are able to get, the parenting training about, issues of abuse, or get them resources so that the children have nutritious food, or, get them help for substance abuse. So things like that.
Thank you, Mary Carole. A little bit about adoption. We strongly believe that adoption, child should remain with the family as long as the family is able to provide safe and nurturing environment. Adoption is an option when people feel they don't have a lot of other options. And it is very important that biological families understand that this is a permanent decision. This is a permanent decision regarding the future of their child. And A lot of adoptive parents do that because they want control, they want to know what's happening with their child, they want to be a decision maker. We'll go to the next slide and we will go further into all these details. But again, safety and nurture is the most important thing which children need from their parents. What kind of behaviors do parents experience when they become foster parents or they become adopting parents? First of all, whatever losses which happened in the child's life prior to adoption, whether it was drug-exposed prenatal care or not enough nurture, not enough interaction, or very disorganized environment at home, foster parents and adoptive parents are the ones who are dealing with that. So first of all, can you imagine yourself being a 2, 3, 4, 5-year-old child who suddenly is going to a different place? How scary would it be, right? Because it doesn't matter how mean our parents were to us, they were our parents. And, there might be not right ways to attach, but we human beings do attach. And, coming to a new place is a huge trauma, and separation with biological family is a huge trauma, regardless of the age. A lot of families come to us and they say, oh, but I adopted the baby, when they were newborn. You know what? You have different smell. Baby hears different voice. Or I adopted a baby at 1 year old. This child had feelings and emotions and was able to understand what's happening with them during this first year of life. So foster parents and adoptive parents, what do they feel? They deal with these losses. So rule number 1, never take it personally. Never take it personally when the child tells you, I hate you. You are not my mom and dad. Throwing fits. It's not about us. It's about this particular child. So, we put in the point confusion about loyalty. And that is a very important point because a lot of children feel that no matter what, they always have to be loyal to their biological family, regardless of abuse, regardless of neglect, regardless of what happened. So how do foster parents and adoptive parents feel? They had that huge dream about becoming a parent, about giving good, and they feel that they will love this child and this child will respond right away with understanding and hugs and kisses, and that doesn't happen. So what often adoptive parents or foster parents feel is a feeling of, am I doing something wrong? I am isolated. I wanted that so much and I am not able to do it in correct way. Fear for their children, family relationships often being kind of destroyed and different, because if that mother is staying at home with the child the whole day and dad is at work, a lot of these children are masters of manipulation. So they will run to dad and they will hop in on his lap. And mom feels isolated, excuse me. So we hear again and again from mothers that this father comes home and I feel like I'm nobody. I am cooking, I am making bed, I'm doing everything I can, but this child doesn't want to have anything to do with me. Often that creates a lot of marital problems and difficulties and creates a lot of blame between mother and father or foster mom and foster dad. There is a lot of tension at home. If there are other children at home, they feel this tension and they say, you know what? I would rather go to my friend's house. I don't want to be here. I am embarrassed to bring a kid into my house. So all that creates, again, a lot of tension and a lot of stress. Often people stop being invited to the family events and to the family parties and so on, because you know what? My child is destructive. People feel tension, and that all of that creates incredible stress and incredible disorganization in environment. And it makes foster parent or adoptive parent question themselves. What am I doing? Am I really bad? Do I feel selfish? How do I make it normal again? How could I get my life back? And why does this kid not love me? We could go to another slide. So what help and therapies are typically provided to these families? First of all, usually traditional therapy is based on mutual trust and reciprocity. And this is something which a lot of children, especially when they become older, they are not able to do. They're not able to respond to that. And guess why? Because they never were able to develop that trust and reciprocity. They never felt safe. Since, children develop their cognitive awareness during the first 2 years of their life, often during the first 12 months of their life. So they, traditional therapy cannot get through that brick wall these children set in front of these people who are trying to help. So that is a main problem. So again, what do our foster parents and adoptive parents experience? They have difficulty finding babysitters. They have difficulty to find family members who want to assist and who are equipped to assist in these situations. They have difficulty to find proper services because, believe us or not, because we are helping these families and working with children and these families years after adoption takes place, there is lack of services. There is lack of professionals who really truly understand what they're doing. Traditional therapies often also create splitting between husband and wife because, again, as we talked before, husband goes to work, mom stays at home with the child learns how to manipulate, and parents starts to disagree. Why do you think this kid is so destructive? Look, he is so loving to me. She is so adorable. She runs right into my arms and she says, Daddy, I really miss you and I really love you. And that creates a lot of misunderstanding. Because husband says, who needs therapy? This kid is perfectly fine, right? And mom says, oh my God, I am losing my mind. Another issue which often comes up is what would this child would be capable of? Because some children come from such difficult environments and they don't know how to act in certain situations. They don't know how to organize their feelings and emotions. And what they do often is what they learned. Did my mom's boyfriend hit her? Did my mom's boyfriend pull the knife on her? So again, a lot of it learned behaviors, and often it creates fears in foster and adoptive parents. How do we protect ourselves? How do we protect this child? How do we protect other children at home? So a lot of these children live their life by learning to trust themselves. So they will do everything in their power to have control of their situation, and not to allow this caregiver, this foster parent, this adoptive parent to feel that they're in control of their life, because that dependency on themselves starts so early in life where they don't understand, they don't know how to explain it. There is no rhyme or reason why they don't trust adults. We can go to another slide. How intentional are we professionals in working with families? How deep do we, do we go and look in the past? How much should we know about the child's past, and what we professionals should do and educate, and what is the best we could do when we are helping a foster family to take on a child? What can we as professionals do to make sure that adoptive family, before they actually adopt this child, really understand what the heck are they doing? Are they equipped to parent? Because, like as an adoption agency, we do home studies, we educate, we require trainings, but each situation is so unique and so different. And that's what we need to pay attention to. And same with the foster parents. So how hard should we push about the information about the child? For example, if it is a caseworker and this child was in foster care before, was with relatives before, it is so incredibly important to know and to understand beginning of child's life from the very beginning. Prenatal care. Did mom use any substances? Under what stress was this mother during pregnancy? Was the father in the picture? How much support did she have during pregnancy when the baby was born? What was the Apgar score? What were the measurements? What was the head circumference, height, weight of the child? Was there exposure to alcohol? Because, doing this work for over 21 years and talking to the top specialists in the country by consulting with adoptive families, we learned that the worst thing biological mother can do to her child is to use alcohol during pregnancy. We all know we don't want her to smoke and we don't want her to use other drugs, but alcohol is the worst thing a mother can do. And if the mother is younger body does a better job processing all this garbage. But as a mother becomes older, our body transfers more and more all that stuff and all this harm to the child. And what it does affect child's brain. And it creates later in life difficulty to understand cause and effect, difficulty to understand what happens after what. And our foster families and adoptive families need to be able to understand. So should we push hard? You bet. Should we try to get as much information as possible? Absolutely. And you know what? We owe it to the child we care for. Because you know what? We professionals see this little bundle, and it is a tiny little human being, and they have the whole life ahead of them. And who we place them with, their life depends on that. And how deeply do we dig into their beginning influences all their life. If the child is 3 or 4 or 5 years old, should we ask for neurological evaluation? And I'm not even talking about the children who are 5 and 6 and 7 years old. Absolutely. And why do we need this neurological evaluation? And who should do this neurological evaluation? That's where we're dealing again and again with knowing our resources and having professionals around us who really understand what is a proper neurological evaluation and what is the reason for that evaluation. You know, whenever we do a test, we want to understand, why do we do this test? Are we going to take medications? Are we going to do behavioral therapy? What are we going to do? So, you know, we always say neurological evaluation is important to understand what are child's strengths, what are child's weaknesses, how do children process their environment, how do they learn the best, what is this child's story? Because you know what, it doesn't matter if we got a stack of papers with child's beginning, but you know what, if in the child's head they have a different story and we don't know that story, we don't understand how should we deal with that particular child. You know, prior to starting this agency, I did counseling and I did work a lot with children in foster care and with caregivers. And it was amazing to me to see how creative these children at, you know, manipulating and putting one caregiver or one professional against another professional. And, you know, sometimes you would have, I remember seeing in therapy a foster family who was amazing, just absolutely amazing. Child had so much trauma, child was throwing chairs in her head, you name it. And then the child went to school and he told the principal of the school that, you know what, my foster mom is really mean and she holds me tight. And here I have a bruise on my arm and I am afraid of her. I am really upset. And this child knows exactly what to do and starts crying and feeling upset. So, you know what happened to this child? This child was removed from that foster mom and was put in the family who were in their, you know, middle 20s, maybe 25, 27. And again, it's not against somebody who's 25 or 27, but, you know, this first foster parent had so much knowledge and ability to understand, and she didn't have a choice. She had a choice of a chair being slammed against her or to hold this child. And that's what I did. So again, we as professionals need to understand what happened in the other foster care placement. Why was this child removed? What happened? Do we need to talk to former teachers, caregivers? Do we need to push for other records, medical records? You know, do we worry that people think that we're very obnoxious and we're asking for too much? You know what? We can't worry about it. We should be as pushy and obnoxious as we can, because you know what? This little kid, who we will place them with, their life depends on us. I'm so sorry. I can talk another hour about it. So let's go into attachment. So what is attachment? You know, attachment is a deep and enduring connection which happens between the child and their caregiver. Oh boy, you're pushing me through, Mary Carole.
No, I'm sorry. We can keep on.
No, that's fine. You know, let me just, a couple of words. I'll try not to talk too much, but you know, attachment to a loving caregiver is really a very basic need of every human being. And attachment is not something a parent does for their child. Attachment is a very reciprocal process, and it's a continuous process between a child and the caregiver. So it is cognitive, emotional, you know, psychological phenomenon, and that takes place mostly during the first 12 months of child's life or first 2 years of child's life. And I don't know, what is our next? I guess let's go to another slide. So, attachment is important because we need to learn basic trust and reciprocity. Attachment helps us to explore environment and do it safely. It helps us to self-regulate and kind of learn how to control our impulses. You know how we often say that this child grew into their body? It's because we all need to grow into who we are. And it creates foundation for who we are as an adult, as a human being. Attachment makes us a compassionate human being. It makes us care for other people. It makes us, care about what's happening in that world. But what it does the most, it protects us against stress and trauma. So, how does attachment start? It's the same slide. Sorry about that. No, let's go back. So, when the baby is born, what happens? The baby starts crying, right? Because there is a need. And that could be a need of changing diaper, a need of food, a need to be held because my tummy hurts, right? So what does child does? They start crying. So if the child cries and mom or dad or whatever caregiver is, they jump in, they pick up the baby and they start feeding the baby because they know it's time to eat, or they change their diaper because they know they're wet, or they recognize their cry because the baby needs, baby's tummy hurts, and maybe they put a warm towel or iron. That's what we did in Ukraine. We would iron towels and we'll fold them and we'll put it on baby's tummy. And guess what happens? This child develops trust, right? So guess what happens if the need arises and this baby is crying and it's a circle? This baby is crying and caregiver doesn't come in. This mom, dad don't come in. And the baby cries and cries and cries. And, eventually they learn to take care of their need. And that's why when we worked in orphanages all over the world, what do these babies start doing? They start rocking, right? They start self-soothing. They do things which will calm that down. But what do you think happens? Who do you think these babies trust? They trust themselves. And that's where the first beginning, the beginning of that distrust to the caregiver. A couple things. Baby's brain is underdeveloped till age 2. But when we're born with all the brain cells we will have. So first areas of brain which develop are eating and movement. Then, brain cells which are responsible for memory formation don't start developing until, children are 6, 7, 5. And that's when we actually remember, okay, when I was this old, that's what happened to me. But early life experiences, they get stuck in human brain in the way we process things. So the number one thing these children need to understand, that bad things will not occur when somebody is in control of our life. So the main concern which happens in attachment issues is when children decide in their brain that something devastating, dangerous, and horrible will take place in their life if they will trust somebody. And that's why our foster parents, our adoptive parents, our grandparents or family members who step in later, that's why they have difficulty to parent these children. Next slide, please. So what do we do with all these kids when we bring them home? how they would trust adult. And you know what? Through years teaching our parents after they adopt children, we tell them, you know what? Nurture and go back as if they're a baby. So we don't care. We tell our adoptive parents that, you know what? You could, after after the bath, first of all, structure and routine. Every night it's the same thing. We give you a bath, we read you a book, we scratch your back. And then maybe after a bath, we roll you into a nice warm blanket and we pick you up as a baby and we rock you. And you know what? Maybe even at age 3 or 4, and some people say, oh, you are crazy. What are you talking about? Maybe you will give them that sippy cup and you will hold them and you look at them and you sing them a song and you look in their eyes. And that milk, and I don't care what milk if they love chocolate milk, go for it. If they love strawberry milk, go for it. Look in their eyes and, feed them. So don't give them that bottle. So because they did this plenty in their life. If it is more of a toddler, chop up their favorite fruit, but don't put it in front of them. How about if you will feed them the strawberries and they will feed you? Because that's how attachment occurs. If they relate more to the mom versus dad or dad versus mom, then let dad have, the most favorite meal this kid has, let them feed this child. But you know what? Spoil them and take care of them. You know what? A lot of parents ask us, what do we do with a kid when we bring them home? They are 6 years old, they're 6, 7-year-olds, they know their hygiene. We don't care. You know what? When they poop, wipe them. When you give them a bath, put them in the bathtub, rub their back, put very good smelling bubbles, give them a bar of soap and let them clean their privates. But you know what? You as a parent have to be there. We can't even tell you how many times adoptive parents who adopted a 10-year-old or a 14-year-old ask, what do we do? They're independent. How we don't want to violate their privacy. You know what? Forget privacy. You know what I would do and what we suggest to our parents? If I'm adopting a 14-year-old girl or a boy, then the dad would need to do it with him. And I want to be a parent. So, and as a parent, the best thing I could do, I could take them to the pool at this age. Because if they are not conscious with their body, if they are conscientious with their body, I'm using the wrong word, you got me here. What the best I could do is I could trust them with my body. So taking them to the pool. And of course, that's not during COVID time. When they don't want us to hug them, they hold on to us, right? Because they're afraid. So whether they want to hug us or not, they have to, right? And I ask parents, does your daughter lock the door when you adopted her at age 14? They say, oh yeah, she's so independent. She wants privacy. You know what? I would go to the pool and I would strip butt naked. And because I have to change, right? From the pool to whatever. And I will tell this kid that I trust them with my body and body is okay. And there is a healthy way. And I am her mom and I will do everything I can. And that's what we try to teach our parents. So again, food, cooking together, baking cookies together, chopping up cucumbers, tomatoes, whatever the heck it is, setting up table together, just being a family. And when people want to bring you gifts, they could bring you puzzles, they could bring you train, they could bring you sewing kits, they could do whatever would allow this foster parent and adoptive parent to connect with a child. We could go to the next slide. Thank you. Oh boy. Signs of attachment difficulties. Attachment disorder is a condition in which individuals have difficulty forming lasting relationship. And often it is nearly a complete lack of ability to be genuinely affectionate with others. So we professionals, when we work with families, we help, and families we serve, how often do we work with mom and dad who never received that love and support and hugs and so on? So what is their perception of caring for this child? How could they take care of the child who potentially have this, attachment disorder? And, by that time, what other diagnoses do these children have? Oh my God, oppositional defiant disorder, attention, ADHD. I mean, there are a variety of different disorders. How many kids you are working with who are put on medications at age 4 for oppositional defiant disorder? Unexcusable, should never take place, should never happen. Because at this point, we don't know who this kid is, right? So signs of attachment difficulties, inability to make eye contact, asking strangers for help, being indiscriminately affectionate to others. Do you know how many times we placed a child and we did international and then we do domestic adoption, and adoptive parents come and visit us, and the child comes in and runs to us, and what we do, we say, oh, no, we're a stranger. You need to go to mommy and daddy, because we should, mom and dad are the ones who you should hug and kiss. So a lot of us initially have difficult time to say no to a child, or the family adopted the child and then they take this child to the church, and this child is running to everybody, and people say, oh my God, this is the friendliest kid ever. Oh my God, this is so awesome. No, it's not awesome. That is concerning. Children should be shy. Children should stay with their parents and trust their parents. And again, all of this are signs of attachment disorder. I will give you a very quick example. We brought a child from Russia many years ago, and the family called and they said this kid is not eating for the whole week because food is love. And they called me, and I have Russian dumplings in my freezer. So it was weekend, I got them there, I warmed them up and brought it to a kid. And as soon as I walked into the house, this kid says, oh, I love you. I said, no, you shouldn't love me. I am just a stranger. And you know what? They didn't want any food. They ate food from me. And I knew right away that this kid has very significant attachment disorder, because food is love. And it took a while, it took a week until this kid started to eat, because they were pretty much depriving themselves. But again, teaching parents is very important. Next slide. Types of attachment disorder, different types. And you know what? As professionals, you will start recognizing different signs, different types as we go through them. Anxious, avoidant, ambivalent, and disorganized. So let's start with anxious disorder. So these kids are overly clingy, excessively upset when separated from their caregiver, eager to please. So what we see with these children, that when they become adults, they are able to make friends, but they demand so much and they're so clingy that kids kind of feel that on their level and they separate from them. If they're teenagers, they will do whatever they need. They will give their stuff to other people. They will buy things for them. They do whatever they can to accept love. When they can't get love, they could get angry. When they demand attention and love in the manner which makes other people uncomfortable. They become very sad and very anxious because they are afraid that when that love is not coming to them. They do try to avoid feelings. They have poor eye contact, and they could be very lonely. They do recover very quickly when then other children with other attachment disorders. Ambivalent attachment disorder.
I think you skipped a page. We're on avoidant.
I did. Sorry, because my vision is hard. I printed it out. So anxious. Oh, okay. So which one? We avoidant. Okay, we're at avoidant. So avoidant kids, they don't enjoy being with others, and they don't feel safe with others. And they don't care if they will have other relationships with other people. And they feel that affectionate relationship is for babies, and they don't need that. They believe they're smarter than others, and they will do whatever they can to avoid feelings. They could be oppositional in a very defiant way. And they will sometimes, the kid who broke your favorite vase, and they said, oh, oops, I am so sorry. Or they forgot to do things, and you as an adult or a caregiver know that is, that was purposeful. Main thing with avoidant attachment disorder is they don't want people to control their lives. So they will do everything they humanly can that you can't control them. And that's why when we adopt these children, when we care of these children, when other family members care for these children, we adults need to find a way to be in control. Let's go to the next one. Is that ambivalent? Short-lived friendship, extremely difficult to parent. They will sabotage and destroy every good things. And they will be affectionate only on their terms and oppositional most of the times. Sometimes parents come to us and they say, oh my God, this kid just, they have to ruin everything. We would have a big family event and they will throw a fit. It will be an event for their sibling and they will do something really nasty. We had cases where children would, try to be in your face, and at their big event, they will poop in their pants, not because they don't have control of their bowels, but because that will create such a reaction and it will create so much control for them. Or they will pee in their pants purposefully, or they will, they will do something to say, I have power and I will make you miserable and I will control this whole thing. So these are children also who would convince, remember the case I was telling you when I was saying a kid in foster care, they will convince another adult and another professional that they are being abused. They're often kids who will be diagnosed with ADHD, and they're extremely difficult to parent. And the last one is disorganized. Disorganized, it's variety of symptoms. It's bizarre behaviors. It's maybe hereditary history of bipolar or other mental health conditions. Or these are children who had such unstable life and they had so much distress and stress in their life that often these kids have to be treated with medications and they do need to get psychiatric evaluation. And, if nothing is done to these children, they do end up in the legal system and they drop off from school and they have complete inability to communicate in real world. And it becomes so scary and so incredibly sad when they give birth to their children, because they are not in the position to parent them. And they just can't. And as sad as it is, they should never parent any human being, because they will create exactly the same scenario in another person's life. So we're kind of going a little bit by repeating, and we did it purposefully. So what do we need to do? How do we find the right help? Do we need neurological evaluations? What resources do we have available? How do we as professionals get together to provide proper resources to foster parents, to other family members, to adoptive parents? Because you know what? Love is not enough. A lot of people say, I will just love this baby. No, it is not enough. And it is not because we are cold-hearted. It's because a lot of these kids had unbelievable amount of trauma. And it takes, you really have to roll up your sleeves and do a lot of hard emotional work to make it a success. But successes happen every day. And we as professionals need to establish a circle and network of professionals who really understand that and could make a difference in this children's life and this family's lives. So all these different conditions could lead to foster care, immediate family placement, or adoption. Mary Carole, do you mind to please cover foster care?
Yeah, of course. So, if children have experienced this trauma that, Ina just kind of went in depth about all these different attachment issues and things, sometimes that leads, whether the biological family is making this choice or whether it becomes the state, looking at, these are typically the three options on the table if parents are not able to be, providing a safe option for their child. And so foster care, like we kind of touched on earlier, that sort of is dictated by the state. So if the state finds that the child is not in a safe position, then they're going to find a temporary home for that child in a foster care home while the parent tries to fix whatever issues there are so that the child can reunite. Sometimes with the state, they'll also look at immediate family. So sometimes that's referred to as kinship care. So immediate family is another option that the state utilizes, but that is another option that biological family can choose on their own as well without the state requiring that.
And what is very important with immediate family members, that we as professionals actually take time to understand, did they parent that individual? What are the resources? What is their level of knowledge? Because again, of course, immediate family is number one choice. But if we are putting this child again with Uncle Bill, who was inappropriate with that biological family, or we are putting them back with a grandmother who is working every night and not in the position to address these issues, we as professionals need to think about all of that. Or anyway, we just need to think about it. I can talk another hour about that. Adoption issues. Why do people choose adoption? People choose adoption, it's okay. You could be on another slide. Thank you, Mary Carole. So most of adoptive parents who come to us, they choose adoption because they want to be in control of the future of their child. And number one, they know in their heart they are not in the position to parent, whether it is due to legal issues, to homelessness, to mental health issues, whatever it is, they know they cannot parent this child. But they want to make sure they have control who will parent this child. They have control that they would be able to have ability to have some visitations with this child, have more updates, pictures, and stay in this child's life and to know what's happening to their child through life. And that is the most important part why people choose adoption. Because we strongly believe that every biological family, regardless what happens with them, whether they are prostituting, again, that doesn't come from a good life, whether they are in severe addiction issues or mental health issues, whatever it is, every parent loves their child. And we have to be very honest with you. We work with so many different parents, and sometimes we bond the most with parents who are just in such deep end, because they're not stupid, they're not bad, they just had a heck of a life, and we're just so lucky that we didn't. So yeah, adoption and foster care. So let's go further. What questions, again, we talk again and we're purposefully circling back. What questions should family ask and professionals provide to foster and adoptive parents? Everything we talked before. What was the beginning of child's life? Who was caring for this child? What evaluations did this child have? Was this child on certain medications? And, you know, as professionals, I feel that it makes us look very casually on a life of the child if we don't dig into that. And you know what? If we don't have time to dig into the beginning of the child and what happened in this child's life, then we shouldn't be doing it, because sloppy work is not allowed in our field, period. So we have to get that information, and we can't stress it enough, because not prepared foster family, not prepared family members, not prepared adoptive family creates so much more damage that we just can't even cover that. I'll be right back. If you could please cover foster care.
Of course. So, you know, me as the queen of foster care, jumping in, a lot of this we talked about, but we just wanted to explain and emphasize, you know, we are a private adoption agency, but we, you know, see the value in foster care when parents, we want to have parents parenting their children if they can. So, you know, biological parents, we want to empower them. We want to connect them to the resources that are available, and empower them and encourage them to let them know that, you know, if you have it in you and you want to parent and you want to, you know, raise these children to be, you know, safe and secure and healthy adults, then we want to help you do that. And so it really helps when it's a team as well. When we talk a lot about, you know, adoptive parents and foster parents, you know, encouraging our foster parents to be cheerleaders for our biological parents, I think is really important, because, you know, we don't assist with foster care to adoption, but that is an option for families, that if, you know, if reunification doesn't happen, it's a mode for some foster parents to be able to adopt. But we really want our foster parents to be champions of those biological parents, because if those parents are really trying to, you know, work on their substance abuse issues or work on getting housing or a stable job, we want to encourage that. And, you know, if biological mom or dad or relative is able to parent, then that's what we want to encourage. And foster care is an option, is an ability for parents to have some time to do that. But on the other hand, we also want to make sure while these children are in foster care that they're staying in the same home if that's an option, and that we're supporting the foster parents as much as we can with the education that Inna was talking about earlier. So that way, when these children who maybe have attachment disorders are being ambivalent or are being, you know, isolating themselves or being destructive with things in the home, that we're supporting our foster parents through that. So that way that child can stay in the home that they're placed in, that they can develop an attachment with that foster parent. And so that we're looking out and being child focused in this and making sure that the child is at the center of our concerns.
Thank you very much.
Yeah.
And same with immediate family. Again, stability is a key. The more often we put a kid in the environment and then we remove this kid from that environment, the more damage we create. I mean, that's number one thing. You know, if the child was with 3 immediate relatives and then he was or she was in foster care, and then this child finds a permanent placement, do you think they trust that adult? Do they think, oh, all these other people in my life who told me that they love me and that is permanent and that is a forever environment, they all lie to me. Why should I trust you, right? And that makes sense. And children are not stupid. They get things, they feel things, they understand, they observe their environment, and it's not what we say, it's what we do. That's what they pay attention to. So again, as professionals, the more we could do to eliminate these traumas again and again and again, and this break in attachment and ability to build meaningful relationship in relationships in life, we need to do as much as we can. Private adoption, that's what we do. We do private adoption, and biological families come to us again because they don't have other options and they want to have control. So it is up to them. They could choose an open adoptions, which could be whatever number of visitations. We as an agency believe in boundaries. Every other agency believes, I mean, each agency has their own culture and their beliefs. We think that it is extremely important that a certain plan is put in place and that there are very clear expectations so that the child is not in the middle of this unstable situation between visitations with biological and adoptive parents, that biological parent never feels used or feels that they had one expectation and something else happened. So it is very important to lay it all down. So it could be an open adoption and it's between biological family, and it starts with biological family, what their hopes are. And if adoptive family is ready to commit to that, then that is a match. If they are not, then we'll look for another family because that's what needs to take place. Or semi-open adoption, when there are no visitations, but pictures and updates are provided to biological family. Again, clear boundaries, clear time frame. And private or closed adoption is when biological family says, you know what, we need to move on with our life and we want to be able to call you and to say we want pictures and updates. Indiana does have a registry where biological family and adoptive family and later the child could sign release, and when they become adults they could connect again if that was a case of a closed adoption. But usually with other types of adoption, that communication continues and takes place. And it is very important that biological family and adoptive family is informed about it because it has to be as transparent as possible. Biological mother, it is her, if family is a couple, it is equal decision of biological mother and the father. Biological mother has a choice if she's not in the relationship to name the father or not to name him. She has 3 choices. This is a biological father, this is his name, and adoption agency is obligated to do whatever they can to find this father to the extent of hiring private investigator, to posting notices in the local newspapers to find their biological father. Biological mother could say, I don't want to disclose who the father is, or I don't know who the father is. So those are the 3 options. If biological father was not named, then he has 30 days from the time that child was born to put his name on a putative father registry. It is very important that biological families understand that it is an option, but adoption is a permanent decision. Never ever should biological family have a full sense or understanding what adoption is. Adoption is a permanent decision, but it is an ability of biological family to choose the family, stay in touch with their child. State of Indiana also allows up to $4,000 support from second trimester up to 6 weeks after delivery, if it is an infant, but after the 6 weeks after delivery, all these other services should be provided by any adoption agency, such as connection with resources, connection with counseling. If the child, if their biological family needs shelter, if biological family needs help with addiction issues, whatever it is. I mean, we as an agency stay in touch with our biological families for years to come, and they can always call us, and we will always do whatever we can to help and to provide resource. Adoption doesn't come without the stigma. And, you know, when we work with biological families, that's their main concern. Would people think that I'm a bad mother? Would my relatives disown me? When the child will grow up, will the child hate me? What would other people say? And, you know, it is interesting, but a lot of women, a lot of men, because we worked with equally men, women, you know, grandparents, sometimes who have custody of children. Every family who is in such a difficult situation often doesn't know all their options. And it is important that they know all their options. And it is important that they, as a parent, understand that they are in charge of their child's life. And other people will always provide suggestion or advice or whatever it is. It has to be solely their decision, which is in the best interest of the child and in their best interest. So again, we, for example, as an agency, we do not provide counseling, pre-adoption counseling, because we believe somebody has to work one-on-one and it has to be very intensive, and it has to be done right. And we feel it would not be quite ethical because we do this adoption work. So we refer biological families for counseling. We try to work with as many professionals as we can, because you know what? Adoption professionals all across the board don't want a child to be adopted if family can take care of their needs safely and the way the child should grow up. And none of the adoptive parents would ever want to parent the child because biological family was deceived or no proper resources were provided to the biological family. So this is a very important piece. And sometimes we do have biological families who come in and say, we want to do an adoption plan. And they should not do an adoption plan because they have a lot of support, and that would be the wrong decision for them and for their child. Again, we talked before, tips for parenting after adoption. Lots of hugs and kisses. You could read what we wrote here, but you know what? Number one thing is a full transparency. And that's why it is so important that we as professionals connect enough information. And you know what? Often we kind of accumulate a lot of negative information. This mom was a drug user. This mom was a smoker. You know, this mom was this and that. But you know what? We should put equal effort to collect positive information about the family. Your mother really loved you. Your mother had a very difficult life. Your mother loved music. And you know what? She loved to dance. And she was awesome at drawing. And her favorite ice cream was chocolate. And, and whatever we can. So please, 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 as professionals, we should never to look at only negatives. We should think about positives as well. And when we talk about transparency, we should always understand things like life book, things like what is age appropriate. And that's why it is so important to stay with biological family, and maybe to have biological family to do a blanket from their old t-shirts of the biological mother, or maybe to put together a life book about her family, or to put a book of family recipes. I mean, right now we're helping a young woman who plays 3 children to us, and we are helping her to put together a story, a Jamie story, because you know what? She had difficult time putting it together, and her kids would need it later on. What is her story? And it's not because she didn't love these kids, because she thinks about them every day, and she falls asleep thinking about them. So it's important when these children become young adults, then they know and understand. So those are main tips we will give to parents, besides all the other stuff. Transparency, transparency, and transparency. That's what helps us to become self-sufficient adults, because there are all kinds of families, and it doesn't mean that one family is worse than another. It's about how we feel as a family unit, and how, when people ask us stupid questions, if we have that family unit, we will look at each other and we will smile, because we have it. And whatever somebody else says, and whatever may be inappropriate language people use, and often not because they mean it. Sometimes people say, I couldn't have my own child, so I adopted a child. It is your own child. Again, not intentional, but we professionals need to teach people that transparency. And you know what? Never ever to settle for 80% of connection with a child, or 70% of connection with a child. These are our children, and we need to push for 100% connection. That's what has to take place. Another thing I wanted to mention, and I think I missed it before, it wasn't one of the slides. What do we suggest to parents? We suggest time in versus time out, because a lot of these children already, they were in timeouts plenty. Also children, if somebody would put you in timeout, would you go timeout and you will think, oh, I'm really bad. Why did I do that? We need to do time in, and we need to talk to children. Why it was not appropriate to throw a fit at the grocery store when you wanted a box of cookies. That was my son, and that was before I was going to every conference every year on attachment and bonding and adoption medicine and all of that. And I mean, he collapsed in the middle of the store because he wanted a box of cookies. And I remember, I mean, the whole store was dreaming that we get the heck out of there. And I came home and I sat him on the chair, and I kneeled on my knees, and I said, hey, Mark, let's talk about it. How did you feel? How do we say that we want this box of cookies? And you know what? The first 45 minutes was crying and liquid coming out from everything possible. And and then we started to talk. Why did mom not buy these cookies? Why we can't do that? And this time ends, it worked. And that was before I listened to all these lectures and all these professionals talking about it. And I thought, wow, that's true, because I did it and it worked. And it's funny, my children are adults now, and they are still laughing how this time ends, how much they hated them. But every time in ended up in a hug and a kiss and moving forward. And it created a need of communication and talking and being with each other. And I better stop because we want you to see a very, very powerful video years ago. One of the presenters showed at one of the conferences. And I think it's truly, you need to be able to read. You need to be in front of the screen because it is not just talking. A lot of it is reading and music in the background. But please, if you could watch it, I think you will find, we both think you will find it extremely, extremely powerful.
So bear with me.
Yes, we are. And we will answer questions afterwards.
Yeah, so we'll watch this video and then we'll go ahead and answer questions. And then I'll also cover how to get the CEU credits if that's important to you. Okay.
I want to talk with you about what it feels like getting ready to be adopted. When you're a little kid who's already had about 100 mothers. Kids like me, see, don't have families of our own. Because there's something wrong about us. Some people say that my first parents shook me until my eyeballs got loosened up. Or they left me alone. Or they gave me away. Or they just ran away. The truth is, I can't do any of these things. I can't forget. Even when my brain does, my body won't. Did you think I was supposed to just be sweet and adorable and ready to connect to yet another family who were going to throw me away? Could you have done that? And so now, I won't let you imagine, even for a minute, that I like you, that I need you desperately, that I might ever grow to trust you. I'm not stupid. I was not blind. I agree it doesn't make much sense for me to join in with all the other people that have hurt me by hurting myself. But I do it anyway. Am I safe with anybody? Doesn't matter anymore. Do you honestly think I'm going to say, "Oh, I get it. You were just kidding all those other times, but this time you really mean it"? And so, do you want to hear something funny? I'll make you sorry you ever thought about trying to get close to me. I'll make you feel almost as helpless and small as I have usually felt. So are you wondering what I need? Never forget that I am watching. I was there watching. I was having deep feelings about what was happening to me, and I needed someone to act as if it mattered, hugely. I told you things matter to me. Whatever that means, is that mostly that nothing is getting decided and I still don't have a family. It would mean a lot to me if you would take good care of my foster family. Someday, see, I will be big people.
Hi, everybody. Is everybody still there?
Yep, we got everyone.
All right. So
Let me share. I can pull up the PowerPoint again. Just pull that up with our.
I don't think we, wait, we
in
could,
case
yeah.
anyone wants to contact us later, but we would love to hear if anyone had any questions about anything that we covered today. We're happy to answer. We want to leave a good amount of time to cover that in case anyone has questions. And you can put them in the chat too if you'd like. I'll pull that up.
I have a question. Can you guys send the link to that video?
Yep, absolutely.
Absolutely.
Who is speaking? I can just send it to you guys when I send the CEU questions. I'll attach that as well.
Okay.
So you all can get that.
Hey, I have a question. This is Nicole Anderson.
Hi, Nicole.
Hi, Nicole.
Hey, so this was very, very helpful information, but I work in a residential facility right now. We have kiddos between the ages of, let's say, 11 and 20. And we do see, although we don't have, children per se, we do see a lot of these same attachment issues in our teenagers. And sometimes it manifests into other diagnoses, such as some of those borderline traits that we see. We also still see the reactive attachment very prevalent. So I'm wondering, what strategies do you know to be effective for the older kiddos that we can probably use in this setting? And then also, I guess it's a two-part question. And my second question is, what is prognosis looking like for kiddos who have experienced trauma and do end up getting adopted? Because we do see these barriers still well into teenage years. And so I'm wondering, what's the hope for us?
That's a very good question. Yeah, we always suggest that proper neurological evaluation, that people start from the proper neurological evaluation. And it is so important to do it with right people and make sure that people understand and give a very clear picture. So that's number one. And number two, if children do not get connections with people in life and not able to build meaningful relationships, it creates legal issues, it creates addiction issues. I mean, it is a very scary path to go with. And honestly, what we feel is, and that's what we're trying to do, we're trying to put together kind of like a networking group of professionals where we all could help and do different pieces to help these kids to become independent adults and to establish trust in other people and to feel that they're safe when they're not in control. And what often is very scary is that there are so many different diagnoses and so many things that sometimes you just need to kind of go back, set back, meet with somebody who really understands all of that. And it has to be a multidisciplinary team, from a person who did evaluation to physician, and to make sure that we are concentrating on the right things. Honestly, on an every day-to-day level, we think these kids need to have purpose. They need to be busy and they need to be put to work. So identifying their talents, identifying what they're good at, creating community events where they cook together, where they, where they're able to establish relationship and trust is number one thing which help these kids. And when parents go into counseling or parents try to put these kids into counseling, this kid should not see counselor on their own, because number one, they will manipulate the heck out of the counselor. Secondly, if parents want to have meaningful relationships with these children, it has to be a mutual session. Parents need to learn how to manage their children. And it is a very, very hard work. And there is no quick fix. And there is no a magic counselor Smith who will just come in and make my kid, respectful and good and whatever. We as parents have to deal with that. And that's why involving parents in counseling, giving them resources prior to make sure that whatever counseling style corresponds to what they believe in. Because if we don't believe in certain strategy, we're not going to use it, and it's just a waste of everybody's time. Believing in that, and again, keeping them busy, keeping them in activities, and identifying their gifts. And that's what would help them to find place in life.
Okay. Thank you.
Absolutely. And we'll be happy to collaborate further. And you're always welcome to call us or, schedule another call or whatever, because we're so open to that. Because when we work with young adults or we work with mothers who are maybe parenting an older child, we want to have as many resources as possible, because it is so important that they succeed and they do well.
Mm-hmm. I agree. Thank you.
Absolutely.
I have a question on a area that you touched on, but just more specifically, we do see a lot of the false allegations from kids that are adopted towards, their adoptive parents or anyone in their family. How can you, best explain that to the parent where obviously it's still a concern and you still have to validate those things, but I have families that just cannot get past it or get over it and are continuing to hold the kid against, hold it against the kid. So any tips that you have around that?
Yeah, I just think it probably starts from the very beginning when people take on kids to say, this kid could report you to us. This kid could say that your husband touched her inappropriately. And we understand there is a very fine line there. How do you not miss something, God forbid, huge? And at the same time, how do you prepare parents? But you know what? Whoever is parenting the child, they need to understand that all these behaviors, it's not because of them. It's not against them. They are just that person who happened to be there. And it's all that trauma which occurred to these kids, and they just happen to be that caregiver. And you know what? If they step in that position, it is very important they don't allow the kid to see that they lost it. If they feel they're losing it, they should give themselves time out. Never, ever allow the child to make you cry, because, and of course, sometimes we get upset and we all cry, but altogether, we want to make sure that these parents understand that the child has issues. And if I am upset and this kid really hurt my heart, I should go in timeout. And I shouldn't say less is more. I should say, I am so disappointed, or I am so sad about it. Maybe not even disappointed. I am so sad about it. I need to take time to think about it. And honestly, these are situations when the kid thinks about it so hard, because you know what? There is no immediate consequence to that, because usually we adults, when we give consequences, we usually punish ourselves, number one. Number two, we attach anger and kind of feeling of helplessness from us to that, because we're not able to deal with that situation. So giving time out to ourselves, and without anger telling the child that that was sad or that whatever, is very important. And then to revisit it when you are composed, to revisit it when you know what you're doing. Because again, we all need to remember, these kids cannot give adult any feeling of control. And they will do whatever they can to make them powerless. So going backwards, we need to be as strong as we could. And that's why we do need to have resources. And we need to call the professional we're working with and to say, this kid is driving. I mean, I am losing my mind. I am losing it. It's creating a horrible stress between me and my husband. I mean, what do I do? But waiting to react. And if you see that there is no way they will allow you to control any situation, then you should allow them that. You could say, a parent could say, we're taking a day trip, and you could refuse to do it. You could throw a fit, you could call bad names, you could do whatever, but I hope we could have a good time. So this way, you are giving them permission to do that. So you're putting, as a parent, yourself in the position of control, because again, it's all about control and mistrust.
Okay, thank you.
Absolutely.
I have another one. I promise you, it's my last one.
No, absolutely. You asked.
So, I mean, just to kind of piggyback off of Jennifer, because we work in the same environment too. So how can we better prepare? Because I mean, I think we're all aware of the flaws in the system, especially when it comes down to how much information parents receive at time of adoption, prior to adoption. And it seems that when kiddos start to exhibit some of those behaviors that were either dormant or whatever the case may be, by the time parents get them into teenage years, they see a totally different presentation from when they were initially either fostered or adopted. And so, I mean, granted, we can't fix all the flaws in the system when it comes down to notifying parents, but what can we do as providers? Because it's almost to the point where parents are so far gone by the time we get the kiddos, even though they're only adolescents. Parents seem so not invested, or they've reached their breaking point where they're just like, I can't do it anymore, to the point where sometimes we get parents that say, I don't care what you do with them, they can't come back home. So how do we as providers validate parents, but also advocate to, I mean, we can't necessarily tell them to keep them. We do tell them to keep them because they're like, these are your kids, you adopted them. I know it was whether it was blind or not, they're your kids. But how do we fix that when we're already in that situation? I know it's not too much preventative work we can do, but on the back end, how can we help these families be more successful?
I just think maybe down the line, whatever we can, and every step, we should try to remember to document good stuff and not to forget good stuff, and maybe include it even in our policies, procedures, whatever we do, or just educational work with caseworkers. Whenever somebody tells you only negative stuff, don't forget to ask about good stuff. And a lot of it is, it's all life. And I think maybe taking out blame in this situation is the best thing we could do, because it's not about the blame, it's about moving forward. And whatever the scenario is, looking at where we are and moving forward. And I don't know if I'm answering your question, but sometimes really complicated situations require the least dwelling, because it is so complicating and it is such a mess And the deeper you're going to dig in that, the more negativity it will create.
Mm-hmm.
So, I mean, creative something positive, creating little baby steps, whether it's our common, I don't know, interest in music, or our common interest in good food, or our common whatever we do, but finding something good with that is really the starting point.
And I think to build off of that too, I think that, you know, a lot of those parents, I think from providers in the past, kind of what we were talking about earlier, you know, they've been accused of abusing their child. They've been told that it's their parenting style that's causing the kid to act this way. And so at a certain point, the parents feel burnt out too. Like, you know,
Mm-hmm.
providers aren't supportive of me anyways, and they think that I'm the villain. And I just think empowering parents to feel like you're not the reason that they are, like you're not responsible for their past, but you are responsible as an adoptive parent for the future of these children. And so kind of saying that, like, I always think it's helpful when you get on the parents team, sort of, but flip it, like, you know, I know that you couldn't have prevented the last 14 years of like what that child went through the system and, you know, through foster care, but here we are. And so like together we
Mm-hmm.
can figure out how to support him for his like future. You know what I mean? Just kind of
Mm-hmm.
flipping that perspective a little bit with the adoptive parents, I think can be helpful too.
Thank you.
That's a very good point. And another thing I would like to add is for us to professionals to understand how did this adoptive parents grow up and how things were in their family, because it's not, again, we all have different parenting style. And maybe this is a parent who, you know, I don't know, people just were not hugging, or people never had family dinners, or family members, I don't know, because we attach different things of how it should be based on how we grew up. So maybe having these conversations with them, and that could create additional topics like what is my expectation and what is my reality in parenting this child, and going from there would help us professionals to better understand that disconnect. And what Mary Carole said, of course, that it's not because we, you know, there is something wrong with us. It's because, you know, this kid needs help, and yeah, damage was done.
Yeah. Any other questions? Those were really good ones. We've got about 5 minutes.
Yeah, great questions.
I, I had something to say, you guys, kind of in relation to what Nicole was saying. This is Christina. I also work with Nicole as well. Hey, Carol, hey. So what I guess it's kind of along the lines of what you guys were just discussing and what Nicole was just saying. We run into a lot of people that's just kind of like, fix my kid. And then you tend to get on the parent side, but you also want to validate the client and let them know that they're being heard. And then when you're offering all these suggestions on, you know, that speak positives, or you're telling the parent how positive this child is now doing in this facility, and you're trying to like boost their self-esteem and give them suggestions on how to praise them to make their transition smoother, they kind of just like negate what it is you're saying. So like, what do you do with the individual that just don't see or believe what it is that you're saying? Because like, I think ideally they think that children are supposed to be perfect, and a lot of our clients tend to say that, well, you just think I'm supposed to be perfect. And then I kind of rebuttal with the, no, I just have high expectations of you because I know that you can do better, whether you feel like you can or not. I know what you're capable of because I see you do X, Y, and Z. So they're really responsive to that, but then it's hard to get the parents on board with that same type of technique. So I guess it's just like, what do you do in that moment where, you know, the parent just is not receptive?
You know, we honestly believe that most of the work needs to be done with parents. You know, it really, really is, because We as parents need to feel empowered. We as parents need to compare the need of this child with our childhood experiences and what was considered normal, but also maybe talking more about cause and effect of different scenarios and our feelings and how we feel. And that's why we believe that maybe talking together and having this joint meeting with both the child and the parent, because it's all about feelings and sometimes feelings clash, but we kind of believe that parent is our number one client versus the child, because and again, I mean, we as parents, we become parents and we have our views based on what is considered normal to us, but lifting parents up, finding things they do well, and same finding things the kid does well. You know what? If the kid got out of your room and did not slam the door, say something positive. You know, don't say thank you for not slamming the door, but say something. You know what? It was so nice of you to it just felt good. It made me feel good the way you laughed. So think about the positive things you could say, even when you could say, oh, this is the first time in your life you didn't leave the room without slamming your door, right? And kind of going from there. So that is very important. It also kind of holding on to little positive threads of hope and strengths in the parents, and making sure that you concentrate on what they succeeded. I mean, I'll give you a 1-minute example. When one of my kids went through teenage years, when he decided to slam the door in his room. And you know what? I was thinking, what do I do? And it happened right after he slammed the door. And I saw my neighbors always renovating. And I got this construction workers. And I said, whatever I need to pay you, could you get the door off the hinges and let us put it in the basement? So my kid came home and there is no door. And you know what? I didn't argue. I didn't yell. I didn't do any of that. You know what? I felt so darn good. I felt like it was a proper message. And he was like, oh, you are so funny. And you know what it means? He could still invite his friends, no consequences. I would still cook dinners for them. But it was that quiet, feeling of satisfaction. I did the right thing as a parent. So I think we professionals need to give as many moments of satisfaction to the parents who are so stressed, to make them feel I can do it.
Awesome. Well, guys, thank you so much. I really appreciate all your questions and your engagement in that. If you are licensed as a social worker and you would like the CEU credits, I will be emailing everyone who attended the session today. Because it's over Zoom, NASW requires that you guys fill out a post test. So I will send you that to fill out. And then if you'll just email that back to me, and then we will be able to email the NASW and give them your info and stuff, and I'll send you your certificate. So we really appreciate it. Thanks, guys, for your kind.
Yeah, thank you.
And so look for that, and then I'll also include the link to that video in the email I send out as well. And if you don't need CEU credits, you don't have to take the test. Don't feel free to just ignore my email. So
and you know what, if you have certain questions, or you are always welcome. We always network with different professionals, and if you have resources or we have resources, we always want to make sure that we stay connected as a community and help children and families. So thank you so much for attending.
Yep, thank you. And we'll stay on for a couple more minutes if anyone needs anything, but otherwise enjoy the rest of your Thursday.
It's a good one. It's a sunny one. So go for a walk. That's what I'll do on the parking lot, right?
Mm-hmm. Yep.
If there are no questions, I think we will leave the meeting. And again, thank you for joining and have a great day.
Perfect. Bye-bye.
Bye-bye.